So hello everyone. So today we have with us Dr. Warid Altaf. He is a consultant orthopedics at Sancheti Hospital, specializing in hand and upper limb surgery. Today's topic of discussion is a broken wrist. Sir, what is a broken wrist and how common is this injury?
Uh, Basically, a broken wrist is a breach or a crack in the wrist. There are two bones in the wrist, the radius and the ulna. So any one of them can break. So this usually happens whenever there is a fall on an outstretched hand, whenever we try to save our head, the chest, trunk region while falling, and then we support our body with the help of a hand, and then there is a chances of developing a crack in the wrist region. Usually the radius, the bigger bone, is the one which usually gets cracked, and depending upon the impact on how you fall, it displaces. There is a displacement in the bone that we come to know on the X-rays. So basically, it is a fracture which happens in the wrist joint, that is on a fall on an outstretched hand.
Sir, what is the usual age group in which these fractures commonly happen?
Yeah, so it's a good question. Usually there's a bimodal kind of a distribution. It happens in young adults, usually when it is associated with a very high velocity trauma, like bike accidents or fall from big heights, or in sports athletes while involving in some kind of sports. So that is usually in 20 to 30, 35. When there's a high velocity injury, and second peak usually happens after 55, 60. That is why the reason for that is when there is a weakening in the bones, that is known as osteoporosis. The strength of the bone reduces, and that is why even with a minor kind of a fall, just while supporting or just having a fall at home from bed, there is a crack and it breaks. So that happens when the bones are inherently weak, and a minor trauma can lead to a fracture of the wrist. So usually in young athletes, and the other group is elderly, weak, osteofragile, usually females who have osteoporosis.
So most of the people in our country do not tend to go to the surgeons or go to the hospital. So what happens if the person with a hand injury or the broken wrist do not underwent any medical treatment?
Yeah, so most of the times we see patients who have not visited any specialist orthopedic surgeon for this particular injury, and it is neglected.
Yes.
So they come at a later time, but the consequences of that usually are, it all depends on how the initial impact is and how the fracture is displaced. If the displacement is more, it heals. It always heals. All the fractures heal, but they heal in a malposition in which there are, which can lead to a malalignment in the wrist, and further, there will be restriction of doing all the daily activities, like moving of the wrist will get restricted. There may be pain while moving the wrist, and they will lose the grip strength, and they will have much difficulties in doing the regular day-to-day activities. Forget about doing any demanding activities or sports activities. So if they are untreated, then it becomes a bigger problem to tackle at a later date, and that can also be corrected, but it's kind of a bigger surgery which could have been avoided at a primary. Maybe it would have been treated with a plaster.
So if the patient comes to here at Sancheti Hospital, sir, what is our offer to them? What is the modalities of treatment of a broken wrist?
So I think whenever we see an injury in the wrist, the first thing is to get an X-ray done and to see what kind of a fracture is there, or is there a fracture or not. Sometimes there is a lot of swelling, but you realize there is no fracture, which settles in a couple of days. So we get an X-ray done and see the alignment of the bones. If the displacement is more, it will need some kind of a manipulation to maneuver it back, align it, and put a plaster. If it is beyond the extent of that, it may need some minor surgery, because even sometimes just aligning and putting a plaster does not help. So they need some kind of a minor surgery to align and to maintain that alignment for that particular period of time till the bone heals, and then I think things go well when all that is done. So I think getting an X-ray done, and then your concerned orthopedic surgeon will tell you whether you need a plaster or whether you need a surgery. So I think it is 50-50 maybe in that sense. In fact, more people may land up in doing plasters only, because most of these fractures are very well treated with the plasters. So that is how.
So you said that most of the people of the later age group around 50s and 60s get this kind of fracture, and most of the people at 50s and 60s do have hypertension, diabetes, other cardiac issues. So these all medical comorbidities, do they affect the outcomes of this broken wrist treatment?
See, absolutely, it's a very good question. And whenever we see elderly patients, they usually have some comorbidities. They have some medical illnesses like hypertension is very common. Every home has a hypertensive patient, diabetes, heart diseases. So they are on multiple medications. So, and once they take all these medications, again they make the bones weak. Most of them, have effect on the bones, and they get weak, and they are more prone for developing fractures. So it's like a vicious cycle. But again, these are minor injuries for that matter, and they all are done under local anesthesia, just making the wrist numb, the upper limb numb. So giving a small injection and doing all the procedure. So it does not involve a very higher risk of anesthesia for that matter. So most of the times, even if there are medical conditions associated, but priority is always to get the wrist back to the normal, so that all the routine activities could be performed by that patient. So I think it does not really have a big impact on this particular injury, because the anesthesia is pretty safe. Sometimes local anesthesia, regional anesthesia, and this procedure is usually short. A plaster procedure is usually maybe 10 to 15 minutes, and a surgery may take half an hour to 45 minutes. So usually it is safe, and it is recommended to get it done even if there are associated medical conditions, because the function of the wrist is more important.
So you are saying that there will be a plaster post the surgery. So if there's a plaster, then how long is this plaster going to stay, and when it is going to come out? So usually what's the
So basically
duration?
there are two modalities of treatment. One is by treating it with a plaster, and another is by treating by a surgery. Whenever we do a plaster treatment, the plaster remains for 1.5 months. That is 6 weeks. So usually the plaster goes above the elbow.
Yes, sir.
For 3 weeks we maintain it above the elbow, so that elbow is also not moving. And once after 3 weeks we remove the plaster and put a small below elbow plaster, so the elbow remains free. The fingers are always free. The plaster does not extend beyond the fingers. So your wrist is immobilized, your fingers are free, and your plaster goes for 3 weeks above the elbow and then for 3 weeks below the elbow. So total it is for 6 weeks. After 6 weeks the plaster is removed. That is the regular protocol. If we do a surgery, which is an open surgery, sometimes a small plate is inserted in the wrist, then there is no need of plaster after that. So you immediately go back to your regular movements, and the recovery rate is little faster, but surgery wise it's slightly a bigger surgery, and it's an open surgery compared to the plaster. But function wise, I think both the groups do good in the long term outcome. So plaster for 6 weeks if it's a plaster treatment, and if there is a surgical treatment, then no plaster.
So if there is a surgical treatment done for the wrist, then what is the duration of the surgery? What is the blood loss in the surgery, and how long does the surgery takes?
Okay. So again, like I told in the beginning, these are minor surgeries. Even if you are doing a surgery in the wrist, it's not a very major kind of a surgery. The surgery is usually it takes around 30 to 45 minutes for complete surgery. The anesthesia time may take 15 minutes. So 1 hour is usually the total time for the operation theatre. 1 to 1 hour 15 minutes at the most. And there is hardly any blood loss, maybe 10 to 20 or 30 ml of blood loss, because these are all done under tourniquet control. So there is no blood loss during the surgical procedure. So yeah, you can consider it like 1 hour. As 1 hour is a surgical time for the whole surgery.
So even if with the plaster treatment or with the plate treatment with open surgery, sir, what is the role of physiotherapy post surgery?
Most important, I think you do any kind of a treatment, physiotherapy will be required to some extent after the surgery. If there is a surgical treatment like a plate fixation has been done, the good thing about that is that we immediately start moving the wrist from the next day. So patient usually, by the end of 1 week, 10 days, he's almost back to the normal range of his movement. Not his activities wise, but his range is usually good. So they don't need much of a physiotherapy for such patients. But if a patient is treated with a plaster, the plaster is for 1.5 months. The wrist is immobilized for 1.5 months. So usually they develop some stiffness in the wrist, which is expected, and they require a physiotherapy for 2 to 3 weeks to get this loosened out, and they get back to their movement. So around 2 weeks of physiotherapy is recommended after a plaster treatment, and maybe a 1 week or 2 weeks of physiotherapy after surgical treatment.
Okay, sir. Sir, usually the patients after the surgery, they want to know that what is the duration of time when they can go back to their normal activities, and especially when we are doing the surgery in young people, they ask you, when can I go back to my sports or go back to gym, when can I start lifting weights. So these are the usually the problems they are unable to understand how much time do they take to get back to their normal life.
Yeah, exactly. I think this is the first question which most of the patients ask when they know they have a fracture, and when they will get back to normal, what they used to do before. So one important thing is that they will be absolutely normal. In all these fractures, they definitely will be normal, but it's all about matter of time, how much it takes. So when we do a plaster treatment, usually I think the recovery time should be around 3 months to getting back to normal activities. Okay. 3 to 4 months for sports activities, maybe 4 months for all regular activities like driving by bike or car, or doing all regular office work or homework and things like that is 3 months, and sports activities at 4 months. If we go for a plate treatment, I think it is a little bit earlier than that. So he can go back to his driving and homework and office work in 2 weeks. Once the stitches are out, he can drive a 4-wheeler, and the patient can go back to do his all routine work, light work, and maybe at 2 to 3 months he should be doing slowly into the sports activities or gymming or push-ups and other things. So 2 to 3 months for a plate fixation, and 3 to 4 months for K-wire fixation, that is the plaster treatment.
So you're talking about the open surgery and plate, and do these plates needs to be removed later? Or it can stay in the body?
This is again a very common question, because the patients are always conscious about having any implants in their body.
Yeah.
But I must tell you now, like in the last 1 decade, I think we hardly remove any implants unless they are creating any trouble, because most of the implants which are used now in all orthopedic surgeries, they may be steel or they may be titanium or any other metal which is available, needs not to be removed, because they are all compatible with the bone. They are of that grade of a stainless steel that which needs not to be removed. They are very much compatible with the bone. If at all, even some patients want to get it removed, even they don't want any metal inside. So I think the ideal time is 1 year. After 1 year, we can remove it by doing an X-rays, checking the final healing and everything. So at 1 year it can be removed, but I am again saying that it is not recommended to remove any implant, because it does not make any difference.
So these all metals in the body, do they affect in further if the patient suffers any other disease and patient wants to undergo an MRI, or patient wants to travel in a flight, there is a metal detector. So do these implants pose any problem?
If we are using titanium implants, then MRI or passing through metal detectors is absolutely normal. It's not picked up usually by any of the metal detectors. But if you're using a stainless steel implant, even now what we are using now recently, all the stainless steel implants also they are compatible with the MRI.
Yeah.
So I think it's nothing to worry. The MRI can be safely done, and they are small implants. So MRI is pretty much safe, and we are doing MRI of various patients who have various implants in the body.
Thank you, sir. Thank you, sir. Thank you so much. So we have got a brief summary about broken wrist and their surgical treatment. So here with us, Warid Altaf sir gave us complete idea if the patient undergoes a wrist surgery. Thank you.
Thank you.